Early breast cancer screening clearly has, and this, you can back this up with studies, has reduced the mortality of patients with breast cancer.
I still advise patients to do clinical breast exams. I've had a number of patients who come to me with diagnoses of breast cancer who have found a lump or an abnormal mass despite a negative mammography or ultrasound. So I do still counsel that patients should do that.
Women over the age of 45 should be screened every 1 to 2 years. Some of the societies recommend starting earlier at 40. And this is for average risk patients.
For any woman, if they have a good health, and if they want to continue their screening mammograms, have a life expectancy more than 10 years, they can still have their annual mammogram. So the difference is frequency is every 1 year instead of every 2 years.
The earlier we find the breast cancer, basically the likelihood of cure would be higher. Obviously, the type of the treatment these days, we are more toward neoadjuvant chemotherapy, meaning that we give chemotherapy upfront before surgery for different reasons. Number one, saving the breast. Number two is that we find out about the nature of the breast cancer, how we did with the chemotherapy after the surgery.
So early detection in breast cancer is key, and it will remain key. When we find a woman or a man with an early stage cancer, we are aiming to treat them to cure. I will say that with stage 4 breast cancer, we do a very good job, and we have patients living very normal, healthy lives for years. However, it does not change the reality that we cure patients in early stage breast cancer, so detection will always remain to be key. Typically, we look at family history. We look at age of diagnosis. We look at Ashkenazi Jewish descent, so anybody in that situation would have a reason to get a genetic test. I think that the importance of that is not discussed enough, and we need to be much more cognizant of genetic testing.
Finding early stage breast cancer gives a chance to the patient to have a higher cure rate and better outcome.